So what I'm going to do now is I'm going to ramp things up here a little bit with the few minutes that we have left. Okay, that was the why. This is the how. Okay. This is what I tell providers and physicians about how you can start doing social media. Okay. First, marketing. This is our cute little community hospital in Salem, Ohio. Okay. Our big news story last week, we're building a patient tower. Woohoo! Big news. I mean, it is big news. I mean, $42 million for a little town, adds big bucks. Okay? So, if you're in a hospital system, you're a physician, you're a provider, whatever you are, this is free marketing. Okay? That should be the easiest way to get people to say, oh, that's interesting. And you remember, 10, 15 years ago, people were talking about, oh, what's the line item for print, or for radio, or for television? This is zero. Next, talk to physicians and providers about online management. This is a whole 3-hour talk right here. Okay. But how I boil it down to physicians and providers is when they tell me, Mike, social media is a fad, it's going away. What I tell them is, go to the computer, turn it on. That little thing over there is called a mouse. Okay. Type your name, hit enter. What do you get? Okay. What a lot of physicians and providers are surprised about is that their first link is not when they were Physician of the Year of their town last year. Okay? It is a physician ratings site like Healthgrades. Okay? And they go, oh, what's that about? Then they read it and they're like, patients are talking about you and you not even know it. It's for hospitals too. You're in a hospital, check it out. Okay? That's usually gets some physicians all worked up. And then we start a dialogue. Next is storytelling. Okay, saw this last week. Time Magazine. Okay. This is Wendy Swanson out in Seattle Mama Doc, arguably the most popular pediatric blogger out there. It was funny last week when this cover came out. We're like, Wendy, write something. We want to hear what you have to say. And she's like, oh, well, I'm hanging out with my boys in the morning, and I don't know if I want to do it. I'm like, come on, Wendy. Tease that, she's good. So this is what she wrote about last week, okay? Go to Seattle Mama Doc, okay, check it out. This is her story behind the cover, okay, what she thinks about it. So whatever you're in, whatever specialty you're in, whatever news story, tell your story. The other point that I tell physicians is that not only can you tell your story, you can clarify other people's story, which may be the wrong story. I tell my family physician colleagues all the time, we have let other people tell the story of family medicine for too long and it's the wrong story. And we as family docs have to try to clarify that. So tell your story, whatever it is, whatever you're passionate about. Because what you've seen today, and what you've seen anybody who gives a really good presentation, is that whatever they're passionate about is a really good presentation. It's a really good essay. So find out what you're passionate about and write about it. Okay? It could be about gardening, it could be about whatever. Social media is also about finding community. Okay? We all know about patient communities. Okay? Talk about that all the time. But providers also have communities. Physicians also have communities. You have to find out where they are. The one I'm a part of is called Family Medicine Revolution. Woohoo! So what do? We collaborate across the country. We find the passionate people out there and say, hey, what is really cool in your community that we can talk about? How can I share this story with people in my community? With people like at the State House or in Washington or policy makers? How family medicine has some of the solutions to handle a broken healthcare system. That's how you find community. There's one out there for you. You have to find out what it is.